referral to be able to initiate hospice services. But anybody can have an information visit. Anybody can invite a hospice person over for information or via Zoom, like what we're doing here, or a phone call, just to know what the services are. And that's a huge part of what Hospice of Green Country is putting out there in the community, is that we find that good people make good decisions with good information. So we want to make sure that we're giving you guys all the information about the resources that are available to you. So in order to be eligible for hospice, what you're going to look at primarily is a person's performance status. What a person's performance status is how well they're able to take care of themselves on a daily basis. What are they able to do for themselves without the assistance of others or devices to meet their daily living needs? So, and I want to back up just a little bit, is that it's not just the diagnosis of cancer or liver disease or kidney disease. It's also this performance status, because as a lot of people will notice, people are living a lot longer with disease processes that 30 years ago, we didn't live as long. Medical science is extraordinary in what they've been able to do for us and our aging and our end of life. So not necessarily just having that cancer diagnosis means you're ready for hospice. Not at all. So looking at their performance status, this is going to be very important. And this is where the caregiver is going to know or going to pick up on these things. So how well is somebody able to take care of themselves on a daily basis? So are they able to get themselves up out of bed and dressed? Or are they requiring assistance? Is it taking them longer to do that? Let's say, 2 months ago, it would take 30 minutes for a person, for a loved one that is getting up, getting out of bed, getting showered, brushing their teeth and getting dressed and, getting ready for the day. Well, now it's taking them 2 hours to do those same things. They're going in, let's say it's a gentleman, they're going into the bathroom. They now have to have a chair in the bathroom to sit down to shave. Maybe they're not shaving anymore because they can't do it. Maybe you, as a caregiver, are having to lay out their clothes for them. And maybe you've been doing that, but now they look at the shirt and they don't know what to do with it. They can't recognize, how to dress themselves. So you're having to do that. Those types of things. Maybe they're sleeping more and they're not getting up as early. That's another performance status indicator, is how many hours a day are they sleeping? And that includes the cat naps. Are those cat naps that maybe used to be 15, 20 minutes now stretching into an hour and a half? Now stretching into 2 hours. When I ask caregivers, when I ask patients, how much are you sleeping? And they're like, oh, I'll take a little cat nap, just in between my shows. I don't, like this one show, so I'll cat nap about 30 minutes. Meanwhile, the caregiver's over there going, try 2 hours, and so the patient is like, I don't sleep that long, do I? And so, you get a lot of insight when you ask these questions. Another performance status indicator is, are they able to toilet themselves? How much assistance do they require? Are there any accidents? Whereas, maybe they were able to get to the bathroom on their own, take care of business in there. You never worried about it. And then now there's been a change where maybe they're not getting to the bathroom in time, or they're having consistent accidents. Maybe once they get in there, it's taking a long time, where they're not able to clean themselves, like they used to, those types of things. Again, that's going to indicate or illustrate a difficulty in their performance status, a change in their performance status. Other things is about eating. So are they able to prepare a light meal? Can they make a sandwich? Can they warm up leftovers? Those types of things. And then when they're seated to eat, can they cut up their own food? Can they take the utensil from the plate with the nourishment on it to their mouth? Or is it ending up on the front of their shirt? Are they having difficulty with those types of things? Maybe they used to be able to eat breakfast in, 30, 45 minutes. Now it's taking 2 hours to eat breakfast. And then we're butting up right to lunch. And then so maybe we're skipping lunch because it took us so long to finish breakfast. So now we're only eating 2 meals a day. You see how we're painting this picture of a slow decline. I think a lot of people think hospice has to be this sharp, plunging decline. And for most people, it's not. It's this slow, steady, over time decline. Other things, let's say performance status wise, when somebody's ambulating or they're walking, do they now require the use of devices like a walker? Are they doing the, when they go to get up and they're rocking to try to get themselves, enough momentum to be able to stand up? Are they grasping onto furniture and walls as they're walking down the hall? Those types of things. Have they had falls? These are indicators of a decline in a person's performance status. So, those are just small, little things. Our other bathroom items would be when they shower or bathe, are they able to bathe themselves? Maybe 6 months ago, you could help, your loved one into the shower, but you could give them the washcloth, turn the water on, and they could take care of things. And maybe now you go in there and they weren't able to do anything, or the washcloth's still dry because they don't remember what to do with it, or maybe they're too weak, to get certain areas clean, and so they need more assistance. So in discussing the performance status, I don't want to, lose the importance of having to have a end of life disease process or diagnosis. Certainly we have to have that. We have to have that, cancer or congestive heart failure or liver disease or, whatever it is. And that's determined by the doctor and the hospice. I will say numerous times we get a whole stack of medical records provided by a doctor's office, and it's kind of like there's 3 or 4 different hospice diagnoses there. So we have to tease through that information to be able to find out what the overall hospice diagnosis is. But again, we're looking for all of those things in that performance status to determine it's time for hospice. The other course indicator for hospice is that people be in the hospice direction of care, which is for comfort. When somebody has decided not to pursue aggressive or life-sustaining treatment, or maybe when that type of treatment is no longer beneficial, where someone is not a candidate for surgery because they've got all these other problems going on, or maybe they're not a candidate for treatment because the treatment would actually cause them to feel worse or be more of a burden. So, again, the things are the diagnosis from the doctor. The performance status indicates that there's a decline in overall performance status, and then that the person adopt the hospice philosophy of care, which is for comfort. Those are the 3 main things when talking about hospice. But the good news is you can get that information way ahead of the time when you need it. And that's what we're hoping for, is to get that information in people's hands like we're doing here today, and we've been given that opportunity by Morton, so that people know about us before they need us. So does anybody that is in our group today have the information that I shared? Does that sound different than maybe the hospice experience they've had?
Okay, thank you, Ashley. We're going to stop the Facebook Live, and then we'll go to our group. And thank you so much for sharing with us. That's great, great information. So I'm going to turn off Facebook Live here. And Now, I think we're back. Let me get everybody else back up. Okay. Unmute everybody. Okay, you can go ahead and ask. All right. Can everybody hear us now? I'm going to get ready to take you back onto videos here. Oop. Start video. Everybody want to start your video? If I can't get you on, can you hear me? Yeah, there we go. There we go. Getting everybody on here. Who else do I don't have Marsha on? Okay, we've got everybody. Charlotte's not back on. Okay. We got everybody? Let's see, I think we're still missing somebody. Joy, or let's see, did we lose Joy?
I'm on.
Okay. Mina, are you on? Need to unmute. It looks like people are still muted. Just unmute.
That's really neat how the instruction comes up of what to do. Oh, look at that puppy.
Okay, so it looks like Kathy's the only one. Okay, everybody on? Okay, good. All right, great. All right, so Ashley's with us live. So now questions, what question did you just ask Ashley about? What were you just saying?
I was just asking if the information that I shared, does that sound different than what anybody has known for their hospice experience, or what different than what they expected?
It's different than what I expected, really, because I expected more of somebody that, you know, you think of somebody that has cancer, or somebody that's, you know, devastatingly ill in bed and not able to do anything for themselves at all. And you're talking about a person who is up and about and can do some of these things. They're declining, but they can do some of these things. And there's a bunch of these performance things that certainly relate to my husband. He has dementia. So.
And that's a disease process. Thank you for sharing. And that's a disease process. It's really difficult, you know, for people to know when is it time, because people can live a long time, you know, with dementia. And then there's other people that the disease progresses very quickly. So that's where that performance status really comes into, you know, a value to be able to determine, is it time or not? And really that's where what hospice is there for, is to be able to determine that. You know, hospice may come in and say, it's not really time now, but when you start to see these things, then you'll know it's time. So it's really exciting to be able to have the opportunity today to make sure that we're getting that information, you know, out there to people. But I think, and just like what you said is so important, I think a lot of people have this vision of the hospice patient laying in bed, a lot of blankets, and unconscious. And I'll tell you, you know, I just returned from a woman's home, and she's sitting out by her pool, you know, in the warm sun, and we're admitting her to hospice. And I'm thinking, that's what I want. I want to be able, you know, when it's my time, to still be able to sit out by my pool and enjoy, you know, the sun on my skin and the warmth of that, you know, and these types of things. So it's really a very cool opportunity to be able to let people know that the hospice patient doesn't look like what we think it does.
Yeah, I mean, I don't know whether my husband would be out of bed long enough to even visit with anybody. He sleeps, you know, hours and hours and hours.
Kathy, did you have a question?
Yes. My has been diagnosed with stage 4 cancer for a year and 4 months. Had rounds of chemotherapy, immune therapy, and has opted to not have any treatment for about 6 months. And then they'll do another MRI and a CT scan. But how could she get information? How could she get information about hospice? Would she ask her social worker there at the med center to send somebody
So,
about hospice? Because I think, and also hospice said to me, she says, Kathy, I don't want you to visit me because I have to clean my house. So does hospice provide also?
okay, thank you for asking those questions. I appreciate it. I had a little bit of a difficulty hearing you. I think the audio was cutting out a little bit, but I think I got it. So the questions are, who do you ask to get, the hospice information? So a couple of different things. First of all, I want to, I represent Hospice of Green Country, where, to me is the very best hospice, in the Tulsa area. You have a right to choose whatever hospice agency you want. But it's difficult to know who to choose. When you haven't used a hospice before, there's so many of them. How do you know what's the good one, kind of thing. So no, you can call any hospice and ask them, will you send somebody out to talk to me? Or can you tell me over the phone, what services you provide? We have so many people call us and say, I was just in town to visit my dad and he is not looking good. This is what's going on with him. Do you think he's ready for hospice? And then that's a conversation. So, know that anybody can call a hospice agency and ask questions and gain information. But to answer your question, absolutely.